SHAW stands for Specialist Health and Work Service, and we're based on the grounds at the Naval Hospital. And what the service does is support anyone who's affected by cancer or someone who's caring for somebody who has cancer with any work-related queries.
We can support somebody from the point of diagnosis with anything to do with their work. So that means we can write supporting letters, we can go to employment meetings with them, we can have one-to-one support calls with them, or also people get their information from us in different ways. So sometimes people prefer to come along to workshops that we hold online, get the information from there, and go away, and they can also come back to us as well. So it all really does depend on what that person needs from us.
So sometimes we have maybe a client who comes along who are looking to return to work, but there can be a lot of emotion and anxiety around that, especially if you've been out of work for a little while, if you've been going through treatment and things like that. So sometimes it's just working through that process, how to speak to the employer, communicate what you need, how to ask for these reasonable adjustments, and just kind of supporting them through that whole process.
I think that quite a lot of the time what we see is people not really knowing what they can and can't say to their employer, what they can ask for, what's actually reasonable and what comes under, because cancer is as a registered disability under the Equality Act, there's actually things that employers are bound by law to try and support that person with, to make sure that people that have cancer and are going back into the workplace have like an equal opportunity to the working environment as people who don't have cancer. And I think that's where we come in to try and help that person be more informed so that they know the things that they need to in order to get to that place. We are so grateful for the funding because of all the different ways that we support people. Having this money means that we can continue to, develop new workshops and support employers in different ways as well. And I think that's something that the service is focusing a bit more on, is also kind of looking at different ways that we can help employers enhance their skills and share best practice in order to continue to support people the right way in the workplace, and share our outlook about how best to support someone with cancer in terms of best practice.
It makes a huge difference. For a start, it allows us to continue running the service. We want the service to be as accessible as possible and to reach as many people as possible, so that anyone who has a cancer diagnosis knows where to go for support around work-related queries. So that means we can develop our workshops. It also means that we can offer more one-to-one support and maybe even scope to do some more support with employers as well.